One day, there lived a girl named Ria. Ria lives happily with her parents. Ria's house is very clean. Both parents are very strict with cleanliness of the house. Because the house is clean, then Ria almost never exposed to the virus or parasite that cause disease.
Meanwhile, in Ria's life, she is always busy. When studying, Ria more often stay at home and do her tests. Ria very rarely in her return house. A test that failed makes it very busy and rarely clean the house.
Garbage books are falling apart and the weather in the bedroom were rarely replaced, so it became mosquito breeding.
In the mosquito world, live a queen of mosquito named Mala. In Mala's body, there's a lot of parasites that can infect human by her bites and make human infected. Mala and her people always moving from one place to another place with a purpose to searching of human blood as their food.
While she is sleeping, Mala and her peoples enter Ria's room and saw a fresh blood inside Ria's body. Suddenly, Mala and her peoples bites Ria's hands and feet. Ria was shocked. She feels like there's something bites her. When she looks around, she saw a bunch of mosquitoes flying around her.
4 days after Mala's bites, Ria feels shaking chills that can range from moderate to severe, high fever, profuse sweating, headache, nausea, vomiting, and diarrhea. Then Ria decided to call her mom to come and visit her, and then bring Ria to the doctor. When Ria's mom arrived, she decided to call a doctor to come in Ria's house and check up her condition. When the doctor arrived, she directly go to Ria's bedroom and examine her. After the doctor examined Ria, she diagnosed that Ria was infected by malaria. So here is the explanation about malaria.
Malaria is a life-threatening blood disease caused by parasite transmitted to humans through the bite of the Anopheles mosquito. Malaria is typically found in tropical and subtropical climates where the parasite can live. The World Health Organization estimates that about 3.2 billion people are at risk of malaria. In the United States, the Centers for Disease Control and Prevention report 1,500 cases of malaria annually. Most cases of malaria develop in people who travel to countries where malaria is more common. In fact, mosquitoes carry the Plasmodium parasite. When this mosquito bites you, the parasite is released into your blood stream. Once an infected mosquito bites a human and transmits the parasite, this parasite multiply in the host liver before infecting and destroying red blood cells. Malaria is typically found in tropical and subtropical climates where the parasite can live.
Disease can be controlled and treated if diagnosed early on. Unfortunately, this is not possible in some areas of the world lacking in medical facilities, where malaria outbreaks can occur. In most cases, malaria is transmitted through the bites of female Anopheles mosquitoes. There are more than 400 different species of Anopheles mosquito. Around 30 are malaria factors of major importance. All of the important factors species bite between dusk and dawn. The intensity of transmission depends on factors related to the parasite, the factor, the human host, and the environment. Researchers are working hard at improving the prevention of malaria infection. early diagnosis and treatment with just one malaria vaccine close to being licensed upon.
An affected mosquito becomes infected once it feeds on an infected individual, thus beginning the cycle again. Malaria can occur if a mosquito infected with the Plasmodium parasite bites you. An infected mother can also pass the disease to her baby at birth. This is known as congenital malaria.
Malaria is transmitted by blood and organ transplant, transfusion, use of shared needles or syringes.
The symptoms of malaria typically develop within 10 days to 4 weeks following the infection. Symptoms may not develop for several months, so malaria can parasite enter the body but will be dormant for long periods of time. Common symptoms of malaria include 1. Shaking chills that can range from moderate to severe. 2. High fever. 3. Profuse sweating. 4. Headache. 5. Nausea. 6. Vomiting. 7. Anemia. 8. Muscle pain. 9. Convulsions. 10. Coma. And the last one is bloody stools.
The prevention of malaria has three: insecticide treating mosquito nets. Long-lasting insecticidal nets, or LLINS, are the preferred of insecticide treating mosquito nets, or ITNS, for public health programs. In most settings, WHO recommends LLIN coverage for all people at the risk of malaria. The most cost-effective ways to achieve this is by providing LLINS free of charge. 2. Ensure equal access for all. In the parallel, effective behavior change communication strategies are required to ensure that all people at risk of malaria sleep under LLIN every night, and the net is properly maintained. 2. Indoor spraying with a residual insecticide. Indoor residual spraying, or IRS, with the insecticide is a powerful way to rapidly reduce malaria transmission. Its full potential is released when at least 18% of houses in a target area are sprayed. Indoor spraying is effective for 3 until 6 months, depending on the insecticide formula used and the types of surface on which it is sprayed. In some setting, multiple spray around are needed to protect the population for the entire malaria season.
Anti-malaria drugs. Anti-malaria medicine can also be used to prevent malaria. For travelers, malaria can be prevented through chemoprophylaxis, which suppresses the blood stage of malaria infection, thereby preventing malaria in women living in moderate to high transmission areas. WHO recommends intermittent preventive treatment with sulfadoxine pyrimethamine at each scheduled antenatal visit after the first trimester. Similarly, for infants living in high transmission areas of Africa, 3 doses of intermittent preventive treatment with.
After that, the doctor said that Ria should immediately taken to the hospital because the malaria parasite has spread her body.
Thank you for watching.